My name is Emily Shelton. I am an OBGYN and I work for Tanner Healthcare for Women. Originally, that was not my plan at all. Thought I would enter into primary care. I fell in love with surgical subspecialties, and the first day on the labor and delivery unit, I saw a baby be delivered, and it was one of the best experiences of my life. And after that, I began pursuing that and fell in love with the day-to-day in and out of the practice of obstetrics and gynecology. It's busy, fast-paced, but also we get that primary care access to women, and that we provide care to them from the age of 13 all the way until 93. And it's that sort of primary care base, but with that surgical subspecialty on top of it that sort of meshes all of that together and made me fall in love with obstetrics and gynecology. I had an interesting path into medicine in that early on, I knew that I wanted to care for people, and that path began with following my mom into the ICU unit here at Tanner Medical Center as a kiddo. I would often play sick at school so that I could come to work with my mom, and she knew I wasn't sick, so she would bring me in and I'd follow around Dr. Bill Waters, who became my mentor later on. And at that point, I decided through that process that I wanted to care for my community in a way that best served my talents, but also served them well. I love seeing patients every day and getting to spend time with them and knowing what's bothering them or taking care of them from a routine standpoint. It is that interaction day to day that keeps me moving forward. I think the best thing about being a doctor specifically is being able to practice medicine at home in the community that I was raised in. I feel like that allows me to care for patients in a way that is different if I was somewhere else. Because I understand where people are coming from, I kind of know the background of what we were raised and taught and brought up in. And I think that that allows me to care for them in a way that's different if I was somewhere else. And it's that joy of being able to share those moments with them as they go through their life, whether that's pregnancy or caring for them on a day-to-day basis. Meeting those milestones with them is what I love most about practicing here. I am most passionate about providing excellent care here. And I know I keep coming back to community, but I feel like in this specific location, we're a little bit limited. For subspecialty and specialty care, most folks have to go to Atlanta or to Birmingham. And so that was a big draw for me to come back here. And so to provide specialty care of obstetrics and gynecology here and surgery options that run the gamut from your typical hysterectomy all the way to robotics and minimally invasive surgery. I love being able to provide that care no matter where people are coming from. I love surgery. I love minimally invasive surgery, but more than that, I love being able to provide a service to a patient that meets them where they are. The most important thing for me when I'm caring for a patient is that they understand what's going on and that they're able to make an educated decision about what they want for themselves based on that education. Whether that's a delivery or a surgery, I want them to know what their options are, whether they want to have a vaginal delivery, whether they want to have an induction, what part of that provides a benefit to them, and then also what are the risks associated with that decision. When a patient can make that decision with good education, that is the right decision for that patient, and that is my whole approach to caring for people. Tanner was an easy choice for me. I had always had the goal of coming back home to Tanner to work as I grew up here, but when it came down to practice styles and the amount and level of patient care that our patients receive here, it was an easy choice to decide this is where I want to practice with these excellent OBGYNs alongside of me.